Hello.
How's it going?
Good. Let me see. Hold on. Okay, there we go. Hi, how are you?
I'm good. Oh, you are super, what, Irish, right?
Yeah, yeah,
That's
born
cool.
and raised.
This isn't your
Yeah.
name, right? It's Sidhbh, is that right?
Yeah, yeah, very good. Yeah. So, I'm logged in on my sister's
Yeah,
account. My
okay. That's what I
sister's
was
my
making sure. Yeah.
manager.
Oh, that's cool. That's what I'm saying. So that's yeah, you guys
Yeah.
all got cool names. Yeah, I got a thing for redheads, so I've kind of rented a few Irish women in my time. I knew a Rasheen, and she actually had a sister named Sive, which I thought
Yeah.
was
Yeah.
I never would have guessed that's what your
Very
your
good.
name was if I didn't know that before.
Yeah, yeah, yeah. I'm very impressed. So,
All right. Well, thanks so much for your time. Little different guest I have today. I, I have Miss Sidhbh Gallagher, plastic surgeon out in Miami. Thank you so much for your time. Are you a little bit more like downtime this time of year? Like most of my clients that are plastic surgeons, they get a little bit of a break. A lot of people don't want to be recovering around Christmas time and stuff.
yeah, it's funny. This is often a busy season because some of the work we do, people get insurance coverage, and so they only remember, to do it as they're coming up to the end of the year and their deductibles are met, So it is actually pretty busy this time of year.
Oh,
So
cool. Well,
yeah.
then, yeah, definitely. Thanks. Appreciate it. So, just before we get into all the cool stuff, maybe tell me a little bit about your background. Like, are you from here? You're from the US?
So born and raised in Ireland.
Cool.
You probably hear the accent a little bit. It's still there, even though I've been over here, gosh, like about 19 years now. And so, born and raised in Ireland, I did medical school in Dublin, in Ireland, and only worked there for 1 year because I could kind of see back then it was hard to become a surgeon over there. If you're a girl. So I ended up coming to Philadelphia, doing general surgery in Philadelphia, then doing plastic surgery in Indiana. And so 9 years of training after medical school and worked for a little bit as an assistant professor in Indiana at IU, and then set up my own practice 5.5 years ago here in Miami.
That's cool. Did you just go out to Miami for work, or did something else bring you there?
Yeah, I mean, like I just love the weather. It's like today excluded, it's raining here today, but I love the vibe down here. I love how international it is, and there's so much to do, with the beach on your doorstep. And yeah, so it was really the place I fell in love with. And so I came here, set up a practice here. My sister was in Dubai. She was actually a school principal, so she came over to be my office manager,
That's cool.
and it's been awesome. So
That's,
yeah.
that's really cool. I've only been to Tampa, and that was in the summer, and that sucked. So I'm sure Miami's a lot better, especially different times of the year too.
So you got to check it out, especially this time of year, like December. It's fabulous.
Yeah, no, that's like the main city I haven't seen that I want to see in the U.S. Did you always want to be a plastic surgeon when you knew you want to be a doctor? Or did you want to do something
Uh,
different originally?
I mean, I think so. I knew I wanted to be a surgeon. I knew I wanted to work with my hands, as it were. And I always liked art in school. I loved art, but I kind of hoped that being a plastic surgeon is a little bit like being an artist, but you have to train for so long, you're kind of taking a gamble. But I mean, it definitely does, in plastic surgery, you got to make things function and you got to make them work good or look good. So yeah, it's definitely I'm very happy that I chose it. And plastic surgery to me, it's awesome because everybody can see your results, right? Like there's no fooling anybody. Anybody in the street can look at your before and afters and tell if you're a good surgeon or not. So to me, especially, being able to go into private practice and, be your own boss, it's really nice to have that. It's an even play.
Yeah, that's
So yeah.
that's way better than what we do because it's like we can do everything right, and if someone like just he's like an asshole, like we can't use them as our billboard. Or you can have like someone who's a shitty, maybe trainer or coach, but they have somebody who just puts in the craziest amount of work effort, and they're just awesome, and they use them as a billboard. When like with you, it's like this is it. Like maybe if you wait, I guess maybe that's the main thing. Like give them time to make sure that everything's gone down, and then that's it. So yeah, there's not really you can't do too many kind of bad surgeries, I'm assuming, especially in Miami before you start losing business.
Yeah, yeah. Well, it's interesting. Most of my patients actually fly in
Yeah.
because in Miami there's so much plastic surgery, so you have to have a niche, which
Yeah.
is I have a niche, or two or three. And so, yeah, but for that reason, we get folks from all over the world.
Yeah, so you
So,
probably have. I'm assuming there's just so many people out there who just do nothing but asses. They're just butts, and that's it. I mean, y'all probably were like the earliest adopters. I'm sure that I don't know. I'm sure that like there's probably some pretty bad ones in the early days that maybe you got to
yeah,
clean up or anything. So I don't know. Maybe let's talk about butts because I'm a big fan of butts in general.
yeah,
And
yeah.
like
Absolutely, yeah. Well, I would say Miami is now the BBL capital of the
yeah,
world, and so BBL meaning Brazilian butt lift. But this is interesting. It's something I won't do. I won't do it in my practice, and I'll tell you why. It's actually the most dangerous plastic surgery procedure. And the reason is when you're doing a BBL, typically you're taking fat from where it's not wanted, usually, stomach, back, those areas, and you're injecting it into the buttocks. And what we figured out as plastic surgeons over the past few years is it's actually a pretty dangerous thing because if you go too deep and you get into, there's big veins there, you get what's called a fat embolism.
yeah.
And so these nightmare stories you hear, and it's estimated, depending on the study you read, it's estimated up to 1 in 3,000 people actually die from
Jeez.
it.
I don't hear
Yeah.
about that. Oh man. Well, that I mean that's the same thing that people get with gear, like steroid users. They can get an embolism from the oil going in their vein. So I can imagine shooting fat directly into your vein from in your butt could do the same thing. Yeah.
Yeah, same idea exactly. And so yeah, it's pretty terrifying. So a few years ago, I just decided, you know what? I mean, in some people's hands, they do fabulous work, and I have friends and colleagues who do it under ultrasound guidance and are extremely safe. But for me, a 1 in 3,000 chance, of having a mortality, that just scares me too much. So I actually stopped doing it a few years
Yeah,
ago.
that's wild. Are there other ways to do it, or is that like the only way, pretty much?
Yeah. Yeah, so well, there's a few ways to do it. So, one of my philosophies is, and one of my mentors said this, oftentimes it may be that your butt isn't too small, but it's just your body is too big for your butt. So make everything around it a bit more proportional. And a lot of people will store a lot of fat, especially in the lower back. So if you can go in and get rid of that extra fat with liposuction, you can really kind of make the booty pop. They'll get the projection and you can round things out nicely. So typically, most of my patients who are seeking a BBL or something like that will liposuction around it. So that's one way to improve the contour. Other ways of doing it, some people put implants in and get really nice results from that. I don't do a lot of that. Traditionally, they weren't very well tolerated, like unlike breast implants or elsewhere, people would feel them a lot more because obviously, you sit on your
Yeah.
butt all. But there are newer techniques, and I think there's a lot of promise there as well. So,
And nothing new that they're like
and
really in practice right now, though. They're all developing them still.
say it again, sorry.
None of the newer techniques are really getting used that much right now.
Yeah, they're not used, like, definitely still in Miami by far and away the most common way to enlarge your butt is a BBL or fat. But there is, definitely some promising things coming down the line and newer techniques where you actually put it under the muscle and people seem to tolerate it a little bit better that way.
Well, yeah, I mean that's kind of one of the controversies in the like bodybuilding world right now is there's these girls that will it's not the same thing. They obviously they can't have fat. That doesn't look the same on stage. They don't want that, but they'll do like different injections with different kinds of chemicals that like just make their muscles look fuller on the outside. Or I've heard some crazy stuff like PMA and different things. Are you familiar with that at all? Do you ever see anyone who has anything like that?
Yeah, I don't see a ton of that. Like typically what I see in my practice or what I see colleagues doing is it's really popular, especially in South America, is they've kind of taken this idea of taking the fat out and injecting it into various muscles. And like they'll get really amazing results. But again, it's something I'm a little bit nervous about because in muscles live blood vessels. And, we just talked about the types of mortality. So I don't do that in my practice typically. Other chemicals, hormones like that. I'm just a simple plastic surgeon. I don't prescribe those sorts of things or really see a lot of them in my practice. What we still sometimes see is unfortunately people who've had silicone injected in different parts of the body. Typically with the buttocks as well or the breasts, with like underground people in hotel rooms, really industrial grade silicone in folks, and that is a real problem because basically what happens, that silicone, it just kind of infiltrates into the tissues and you just have to cut it all out.
Uh,
Even the healthy tissue usually has to go as well. So I definitely, particularly earlier in my career, I did a few of those cases and just nobody's happy. I mean, they're just awful. You have to just take sharp bites out of people to treat it, you
Yeah,
know.
I actually now that I'm thinking about it, I do know two people that had pretty bad experiences with their butts. And like one of them went, I don't know, out of the country. She tried to get like a good deal on it, and then that she had all kinds of issues. But yeah, the other like the recovery was just so crazy and so much worse than what they thought, and they ended up having to cancel like really big trip, like going to Rome and stuff because it wasn't far enough out, and like she ended up kind of regretting it. But yeah, I see it now. Like I see the butts where it's like people are trying to be a little more subtle now, at least, where it's like, it's not so over the top. They'll maybe work out
Yeah,
their upper hamstrings a little bit, but there's a lot of fitness girls who, you look at them and you're like, okay, I know not every single girl on Instagram has that amazing butt, and some of them are really open, which I think
right.
is really cool. Like I think that's, you know, way the way to be about it. But
Yeah,
yeah,
yeah, yeah.
are there things like what are some of the things that maybe like people are just concerned with aesthetics? Like I'm thinking maybe like let's say like maybe like a 40 under crowd, whether they competitors or just regular people that are worried about aesthetics. Like what are some of the common procedures that you see? Is like ab etching a thing? I always hear about these rappers doing ab
Yeah,
etching.
yeah, definitely. Ab etching is a thing. People, there's a raft procedure where it's called raft, where people actually put the fat into the ab muscles. Again, we're seeing this is super common in South America and Colombia. But like I said, I'm a little bit nervous about
Yeah.
injecting
That just makes
anything.
it fuller or what?
Yeah, it can be. And the idea is as well that we know that fat is full of stem cells. So we think that maybe, there's growth factors in there as well. And that, combined with working out, it's a kind of cheat code to getting abs sooner. Etching is definitely very popular. I'll do that often. Again, we don't want to have unnatural results,
Yeah.
because obviously a lot of the patients they come to a typical plastic surgeon in Miami, let's say, they don't have those lower body fat percentages that you'd expect to see abs. So it's always a big mistake if you go and completely etch them out. Well, and especially if you're just guessing, where the abs should be.
You don't know where the abs are at. Do you ever
Yeah,
have
yeah.
somebody like that? Would you do it like if somebody's like wants you to do something ridiculous and you're like, okay, but no, you're gonna get what you want, but then you're gonna walk around with my name on you, or you're like, okay,
Yeah, it's a tough one. It's a tough one. So if you're definitely going to, deform somebody, if you're going to give somebody something that doesn't happen in nature, definitely I stand my ground. But I have to say, over the years, um, I've come to understand if you really listen to a patient, and do a really good job in listening, it very rarely backfires. So there are some procedures I do that would be considered a little bit unusual. One of them that comes to mind is testicle enhancement, where guys come to me wanting extra large testicles, for example. So we do this just like breast implants, with we use soft silicone implants, put them in the scrotum. And so to your average Joe on the street, that might be a crazy idea, but never have I ever had one of these patients come back and say, "What did you do to me?" So the patient really has to invest in the decision making and be part of that decision making. But I've found that, really listening to patients, first of all, we want to be safe, we want to do no harm, but it tends to pay off. Those are kind of some of the happiest patients I've had. And there's kind of an old school perception out there from, kind of, it was an old school way of thinking in plastic surgery to be very patriarchal. And especially, this concept of, a girl goes to the plastic surgeon and she says, "I want 300 cc implants." And he says, "No, you need 500. You'd look better with 500," and puts that in. I think we're getting a lot better, at maybe not being quite so patriarchal and really listening to what the patient wants. Um,
that's exactly what happened to my girl. But I do think he was right.
yeah,
She's really white. I think she was trying to be too conservative. He's like, you got some
yeah.
thick lats. You could go a little bigger. But that's funny. So I guess I mean, yeah, you can't put a big enough balls in somebody for them to like look bad for you. But so are these like people that are on like steroids and they've got little balls or what? And they just have
So
four balls now?
Yeah, yeah, pretty much. Like, yeah, so that is a really common group of folks I see because obviously if you're taking the androgens, as you well know, you can get some shrinkage, and so that is definitely a group of patients who come to me because they've lost what they once had. I also have a group of patients who come to me and they're like, I just want to go really big.
Yeah.
I even like those guys will have normal sized testicles and they just want to go, as big as possible. And so it just depends really. But what I'll tell you is, you know, those are some of the happiest patients I've ever seen. It's like there's something that can be, very euphoric. And a lot of people have wanted this for a long time. It's a well thought out decision, and I've never had to downsize
Yeah.
anybody.
Right. That'd be a hard. So how does it even like go in?
Yeah, so it's quite a simple thing. So basically the way I do it now, and we've kind of refined the technique over the past few years, is it's very simple. So first and foremost, you want to leave the native testicles alone. Usually they're working away, they're functional. And so basically we'll put two implants in. I use extra soft, actually I have them over here. So
Little
this is an
paperweight.
example of like an extra soft silicone implant. And so basically it fits in, but you gotta put one in big enough to hide the fact that you have a four pack. So basically it goes down lower and in front of your native testicles. And so in most normal positions, you'll only be able to see the implants and your natural testicles sit behind and they kind of look like the cord,
Yeah.
anyway. You go through just a little incision, usually even the really big ones, and I'll show you like a model of some of like this is probably about the biggest one I'm
Oh yeah, it
putting.
looks like an egg.
Like yeah, like a goose egg. Yeah. The really big ones, even we can usually fit them through about an inch long incision and it's placed low down in the center of the scrotum. And that line in the center of the scrotum is called the median raphe. And so really the scar kind of hides in
Yeah.
there. Yeah. And it works just like a breast implant. It's, the same idea basically. It's like we leave the native testicles alone and they just sit in there and, they look very natural. Well, I should say it depends on the
Yeah.
patient's goals because
Yeah.
obviously, this guy too, these are never
Yeah.
what we
That's
find in nature. So,
what's the recovery like on that?
yeah, the recovery is not bad at all. So typically the procedure itself, it takes me about an hour. I do have guys go to sleep for it. If you do sedation, you kind of wriggle around a little bit more than I'd like, and we have to keep things super sterile, because this is an implant, so obviously we do it in the operating room. And so it procedure itself takes about an hour, give or take, and then usually like I said, most of my patients fly in. So usually they're in Miami about 5 days altogether. We check on things a couple of days later. And typically guys get back to light workouts at about 2 weeks,
Oh
back to
wow.
work like week light workouts in 2 weeks and just not too much core stuff for straining or sex for about 4 weeks
Yeah.
typically. Yeah.
Okay. Yeah. They're probably ready to use their balls. They got to wait a month before they can really show them
Yeah.
off. That's
Yeah.
that's funny. So it's like on guys, androgens shrink things. On women, they tend to grow things a little bit.
Yeah.
So I've seen that you've done some work with like clitoral reductions. Can you speak on that a little bit?
Yeah. Yeah, so that's definitely a growing, no pun intended, like area of my practice. And I see it's very typical that we'll see this problem of clitoromegaly. Now, I say problem because some women definitely enjoy the growth,
Yes,
they
they're calling
enjoy having.
cards for some of them on their OnlyFans.
Absolutely, yeah, and more power to them. But there are a subsection of girls that they're kind of really bothered, by the appearance down there. And typically, what the typical case I'll see is somebody who's had already a labiaplasty or a clitoral hood reduction, or even multiples sometimes, and it just didn't do the job because what they're seeing when they look down, especially when they're aroused, is that they're basically seeing a small penis. And so the other it's the perfect situation because obviously these girls have no body fat, so the labia majora don't hide things, and it can be really bothersome, and in some cases it can be a functional issue as well. These girls have hypersensitivity, it's always rubbing against things, it bothers them in their leggings, their underwear, that sort of thing. So I really enjoy working with this group of patients because usually they've had this problem for years. A lot of girls, it's obviously caused by the androgens or, whatever they've been taken. But in some cases, when they stop it, it doesn't go away. And I think that's actually more common than we think, because
Yeah.
typically when I'm hearing if she's taken testosterone, oh, first of all, a lot of them don't want to stop.
Yeah.
That's
Yeah.
another thing. But if they are going to come off it, we say, well, let's just see how things settle down. And most of those do, come back for surgery ultimately, because it seems to be one of the changes that can be more sort of irreversible, such as voice deepening.
Yeah.
It's
I
a
mean, there's
struggle.
nothing for that, right?
Yeah, well, there is actually. I don't do it, but there is such a thing as voice feminization. That is a thing
Is
where
that
you
pretty
actually
successful?
it is. It is. It's ENT surgeons do it, ear, nose, and throat surgeons do it, and they actually sew the cords together. So it does actually work because you're reducing the size of the cords again. So that works. And clitoral reduction, I can say definitely works. Because basically we're removing. I always say the clitoris, the anatomy of a clitoris is very interesting because it's basically a penis without a urethra. The thing that you through it is just a penis without the plumbing. So basically, what we do is we go in and take the head off, and with the head comes all the important things, which are the nerves, obviously super critical. So we're going to preserve all those nerves, and the only thing I'm getting rid of is the erectile tissue, which you don't need. And so sometimes I'm taking 1, 2, even 3 inches of erectile tissue away, and usually in most girls they want me to reduce down the head, as well. So we'll reduce that down at the same time, lift everything up and tuck it in. And usually in most girls, we do a labiaplasty as well, just to kind of put everything back, origami, make it pretty again
Yeah.
afterwards.
And
Yeah.
is there any sensation lost typically, or how's that for them?
Typically, no, no, I don't think I've had it. Well, I know for a fact I haven't had any patients with loss of sensation, because while you're in there, you're looking under magnification, you can see the nerves, and you're preserving them. That's the whole, aim of the game. Now, initially after surgery, because things are swollen,
Yeah.
bruised, obviously sensation won't be what it is, and there can be a little bit of a learning curve to get used to the new anatomy. But in general, most of my patients express to me that this improves their sex life, because in fact, most girls who come to me with this problem, many of them haven't had sex for years because they're just really self-conscious about it. So again, another really gratifying procedure to do. So
Yeah, especially if, they're not in that world anymore too. Like I've had friends who were all about it and physique competitors, and then when they decide they don't want to do that anymore, it's like a lot of the ramifications are still there, and that can be, that can cause a lot of depression issues and all kinds of stuff. So it's cool to know that there are options out there, that some of it's not, so permanent. Have you ever had guys do that for the dick? Have you ever had them like like they're just too big and they want to like they can't?
oh, dear reduction. Do you know what? So it's funny you asked that. I've had a few guys over the years, but I think they were always pranks. People will call up and like, oh, I need a penis reduction. And there was one of them was actually, of course they sent pictures. So I don't know if, I mean, what was going on with them, but like I did actually briefly think it was a real request. So you start kind of thinking through, how would you actually do that? And it would be a difficult thing to do. It would be a similar technique. You'd have to lift the head off
But
along with
there's
the
the urethra, right, to do it.
yeah, you can shorten the urethra exactly. Like theoretically it could be done, but I haven't heard of it being done.
I mean, those could very likely be real. Then the guys are just sitting there overnight thinking more and more like, oh man, this isn't like, what am I gonna do if
Yeah,
I actually do something bad
yeah.
happens? So like,
The consult requests always come in at 2 a.m., for that sort of thing.
maybe they had a
Yeah,
bad experience and it didn't fit on some like, okay, I'm seeing,
yeah, yeah,
oh, like some other people's problems. What about like, so I lived in West Hollywood for quite a while when I was working up there, and that was like early 2010s, 2010 to 2012, and I saw some pretty wild shit in that community. Like you mentioned, the implanted asses. I saw a lot of those that were early early
yeah.
generations. I seen some stuff like through pants and that I don't know what was going on. What are guys doing down there?
Yeah, yeah. So, the million-dollar question is always, how are you going to enlarge the penis? Of course, the testicles, we have that down. We know how to take care of that, but that is a little bit more niche. But enlarging the penis is a bit more difficult to do. And various surgical enhancements have been described over the years, and they've run into various problems. There's some implants that are still on the market, but they're beginning to get a bad reputation because they can interfere with with the sensation, the nerves, cause scarring, even like erode through the skin, that sort of thing. So the jury's out a little bit on the implants for sure. Now, when it comes to the more popular things that people are using right now are products like filler. Like imagine you're
Yeah.
going for a lip filler, same idea, ultimately same product as hyaluronic acid. And so basically how it works is you go in, there's a set of models, you say, where are we at now? Where do we want to go? And it's really girth. Like that's the main thing that's been enhanced there is the girth. And it's expensive. It's temporary. It lasts about 6 months. But that is pretty popular right now. So it's been injected. And there are pretty high satisfaction rates with that. Other techniques to lengthen the penis. I mean, one thing I do a lot of in my practice is kind of excavations. So we say every 30 pounds extra you carry, you lose about an inch.
Yeah.
So liposuction, pubic lifts, things like that to try and excavate what people already have. But other than that, the jury's kind of out. We don't have a great technique right now to lengthen.
Yeah, I mean, imagine if you did, that's going to be the jackpot for the
Yeah.
guys. We talked about the ab etching. I was curious about some other maybe more common surgeries that the younger crowds are doing that you're seeing that are just purely
Yeah,
aesthetics based.
yeah. Absolutely. One thing, it is a really exciting time, and I just got back from a conference in Paris with two of my mentors were speaking there, and it's kind of like if you think about in plastic surgery, we've figured out the skin, we've figured out the fat, we've figured out muscle repairs. Some people are injecting muscles, like we talked about. So the next frontier is the bones. So what one procedure I do in my practice now that has really high satisfaction rates is rib remodeling. And
Oh
I
my goodness,
used
I'm
to,
sorry to interrupt you. Do you know who Dr. Mike is? Have you ever heard of him?
yeah, yeah,
Yeah,
yeah,
you should reach out to him. You could do his surgeries. He's trying to do all kinds of he was talking about getting ribs removed and then
yeah,
placating the abdomen. But yeah, you should hit up him and then you'll be the one for every bodybuilder ever. But
yeah,
yeah, that's
yeah.
funny.
Well,
So yeah, that's exactly the kind of stuff he was talking about. So you're just shaving them down though. You're not removing them.
exactly. Like, so how it works is so I was trained, one of my mentors has been doing rib removal for years now, like at least 15, 20 years. And he does it and he does it very well. But I was always a little bit afraid of it because it kind of seems a little bit extreme. So he makes an incision about this big on the back and typically goes in and takes 12, 11, and 10. And he takes them
Wow.
out. And it definitely works. There's no question about it. The reason I got interested in it again was there was a surgeon from Peru actually who invented a way of you just kind of break the outer cortex. So, when you talk about a bone, there's an inner and an outer cortex, especially with the ribs. So the cortex is the hard part of the bone. And so all you're doing is you're breaking the outer part. You use a little dental instrument through a puncture. So it's like a blood draw. There's no scar. So you're just using a little instrument called a piezotome, which is what we call osteoselective. So it's only breaking the bone. And then you just reach forward and click it in. So you just click it in. And so all you're doing is you're breaking or making the ribs flexible. Patient has to go in a corset for 3 months. But in that corset, we're seeing people lose like 3 to 6 inches,
So you're not
off
actually
the
changing the bone density at all. You're just
exactly. The
oh, okay.
bone's in there, does its job, doesn't come out, and there's no scar.
Yeah.
So I think that is, it's got a huge potential. It's very interesting. It was developed in Peru because people at high altitudes tend to have kind of more boxier, longer thoraxes, because it's for an advantage to be able to breathe better. So a lot of people in Peru have that kind of their thorax almost meets their pelvis and that kind of
Yeah.
boxy frame. So that's I think why it was developed there because it's a very common
That's
concern.
cool. I do
So,
so much with the ribs. That makes me
look at
think
that.
so much about what would be going on if I were
Yeah.
modifying this. So you're saying where do you take it from? Or you just
So
kind
we're
of
going
compress?
right to the bottom.
Yeah.
Okay, so we're going right to the bottom. So 12, 11, and 10. Now, one
Yeah.
thing that's very interesting is the anatomy down there highly varies. So
Yeah.
yeah.
That's
So
my
we
whole
get a
thing.
yeah. Oh, good, good, good. I'm glad we're like come to the same conclusion. So whenever we do rib remodeling, we get a CT scan first, and you need a CT scan because the chest X-ray doesn't really show you what's going on with the cartilage is in there because again. this will only work if those ribs are free floating, right? Because obviously, if they're connected at the front to the sternum and you do your little break, it's not going to. Now, my mentor does have it's called a conversion where he makes it free floating, but that's a kind of newer technique. Not a lot of us are doing that yet. So typically we're only looking at the free floating ribs. And for most people, that's going to be 12, 11, and 10. But as you know, sometimes there is no 12 or it's
Yeah.
tiny.
That
Yeah.
that's so funny. What is the recovery like? So that's a you said that how long of a process is that total to take for them to
Yeah.
reshape it?
Yeah, so typically, surgery takes me about an hour. People go to sleep for it, completely asleep. And when they wake up, I put them in a soft corset because they'll be bloated around the time of surgery. And then I get them into one of those lace ones, one of the hard ones. And so it's boned, and they'll be in that for 3 months.
3 months?
Most, yeah, they'll be tightening it in pretty quickly over the first couple of weeks. Usually is where we achieve most of as the swelling comes down, bringing things in. And then they hold it there and wear it for 3 months. And it is a new procedure. He only described it for the first time in 2023, but he's done an awesome job at looking at data. And we see that there are a small percentage of folks who may get a relapse. The ribs may come out again. It's poorly understood, but he did notice it's definitely more common in bodybuilders.
Yeah, yeah, just the
So
way they produce force and like air, yeah, air vectors, everything. Because there's a way they can lift without doing that. So that is that like mainly girls that you're seeing doing that, or you have guys doing that
I
too?
see both. I see both. Yeah, yeah, for sure. Definitely it's more common in the girls, and I actually that is the one thing I do get local patients for because here in Miami, we've a lot of Central and South Americans and people from, originally their ethnicity was from the Andes, so we're seeing that, long thorax. So I definitely get more girls, but for the guys too, I've had some folks come to me because I guess, the ideal ratios, the waist to shoulder ratios is it's going to be enhanced,
The golden ratio. Yeah, that's
Yeah.
yeah. A lot of what I do is based off of someone's rib cage position because we have what we call like narrow ISAs and the wider ISAs, and they function just totally different. They have like kind of off different ways of working with your body type. So yeah, that makes sense that you probably see a couple things that are like very different. Like one reacts a little bit differently. That's really funny. Do you know if any of these are like competitors at all? Do they talk to this about you at all, or even like any physique
Yeah,
competitors?
I, I can think of two people who are competitors, but I honestly didn't get into it that much with
Yeah,
them.
I'm
I
sure.
don't know. Yeah,
Yeah.
so
Are there any
yeah.
other like procedures you can think of that competitors would like to do, or maybe that they are doing that would be like beneficial? Because usually the way it works, like for us, is kind of like if they can't tell, like you're not going to get judged down. Like, I mean, it's kind of like not like glorified if you were to do a procedure, but if they don't know, like they don't really dock you down.
Yeah, yeah. And I mean, the thing is with the ribs, there's usually no scar, because
Yeah.
it's a little puncture, so like nobody can tell, at the end of the day. Yeah, so I have over the years come across a minority of patients who come in for liposuction, but again, most people who are serious competitors, they've nothing there. They're very little. Liposuction can be useful if there's a little pocket of stubborn fat that just won't go away, because the magic of liposuction is once you get rid of the cells there, they're not coming back, so it's kind of a lifelong solution, if there's some little stubborn area. But typically most of the patients I see, they're coming to me for, who are bodybuilders or do compete, like they're coming to me for the genital reasons. That's very common. For ribs, again, I've seen a few of those, and I think that's definitely growing, and that's probably about it. So
What
yeah.
about do you ever hear about this was popular back when I was in Hollywood back in the day? I don't see that much anymore, but calf implants used to be pretty wildly popular with dudes.
Yeah, and I mean, as you know, I mean, there's some people genetically, they just either the tendon's really long, or like no matter what they do, it's never going to grow. So we do sometimes see that. It's something I don't do a lot of in my practice, but I have colleagues who do it, and from what I understand, there's high satisfaction rates with it. Because there's kind of a nice little sleeve that it just sits in. So compared to some other parts of the body, where implants aren't great, calf implants, from what I understand, they do work well. They sit in there nicely. So yeah.
So I'm just thinking kind of like what is your like philosophy? So I'm sure like you probably, everyone has to go through some sort of like screening. Do they do like a mental screening or anything before they do? And does that like take care of like real crazy people right away. If you see something just wild, like they're asking for something like that's like unattainable. But like, is there a part of you like, is it all individual? Are you ever like wondering potentially like maybe they're just like they should be happier with how they are. They could do something else. Do you try to push them? How's that from like a like your point of view? I'm always curious.
Yeah, that's a great question. So, certain patients that I have to do, certain patients that I treat, maybe they're using their insurance, so they do go through psychological evaluations, as part of that whole process. And I have to say that the folks who were turned down, I mean, you would turn them down too. It's quite
Yeah.
obvious maybe they're quite unwell at the moment, and they need to work through some other things. So I don't think like psychological screening is always the best tool, because especially, you're putting your psychologist in a situation where they're doing maybe one or two sessions with somebody, it can be hard to maybe elucidate very
Yeah.
subtle things. But in general, like I said, my philosophy is you involve the patient as much as possible in the decision making. It's like there's certainly times I say no. If I feel like we're going to do something, that's unsafe, that's immediately a no. Because I'm a chicken. I don't like risk. That's why I
You're a
won't do.
doctor. That's the worst thing for you guys. Yeah.
Absolutely, because at the end of the day, these are aesthetic procedures. They're not life and death, so I have very low risk tolerance, when it comes to that sort of thing. So, first and foremost, can we do it and can we do it safely? And always are we meeting that patient's expectations? So in my practice, I try to make as many before and after pictures available, because certainly if it's my work, if I've done it once before, I can do it again, more than likely. And I always welcome inspiration pictures as well, because sometimes we just don't have the words,
Yeah.
so like definitely inspiration pictures over the years have saved my ass, because a patient will come in and they're like, I want a natural look. And I mean, what does that mean, right? To me, that means one, and then they bring me in, like double E implants, I'm like, oh, okay, this is natural. Okay. So, but like I said, my philosophy, is again just really listening to patients, and trying to meet those expectations. Usually, it serves you well, you
Yeah.
know. So
Yeah.
yeah.
I mean, that's got to be, I mean, it's kind of like, I don't know, like that's a weird position to be put in. I almost feel like you said, like you guys should have a third party to like do the first part initially. So that way they definitely do screen the kind of ridiculous ones. But yeah, it's like, I mean, a lot of people get surgeries and then in the right headspace and then afterwards they're not and like they regret it later. So it's like, it always changes too. So they might be really good right then and there. Is there, like, with I'm curious about like the GLP-1 stuff that's going on right now. Like that's
Oh yeah.
super widespread. Obviously, I'm here in Newport Beach, so we're kind of like Miami, right? We've got same kind of clientele, I'm sure.
Right.
And
Oh,
like, are you noticing like is this having an effect like on liposuction? What are you seeing with the influx of GLPs? Is there another like something that is creating? Is there any surgery, any need that is creating, or is it just getting rid of all the fat loss surgeries?
yeah, for sure. So it's been a game changer, because uh, certain procedures I do, you can't do them safely at higher BMIs. We use BMI, but I mean, of course, it's
Yeah,
not accurate, it's not, but it's the kind of most widespread thing we use. And so it used to be you'd have to tell the patient, I'm sorry, we can't safely do it at your current weight, lose some weight and come back to me. And it would be very rare those patients would ever show up. Then GLPs came along, and it's people are actually losing the weight, which is wonderful, because now whatever procedure they were seeking, they have access to it. So it's been one aspect of it. But then the other aspect, of course, is loose skin.
yeah,
So and I don't think personally that the GLP-1s predispose you to it any more than
just
other forms of
losing a
weight.
bunch of weight. Yeah,
Yeah, like loose skin is loose skin, and so we're seeing an uptick in facelifts, and for me, tummy tucks, arm lifts, have really become a lot more common in my procedure sorry, in my practice, and as well as that, like we alluded to earlier. everything kind of down below, because for example, a lot of guys who are very heavy, they lose the weight and everything kind of telescopes, so we'll do pubic lifts and things like that to excavate their genitalia and the penis, and it can help with that. So I'm seeing a lot more of that in my practice. And then just from a practical point of view, the worst thing a patient can do is forget to stop taking it around the time of surgery, because it causes their stomach not to empty. So most surgeons won't operate on you unless you've been off it for 2 weeks, so
Yeah.
that's like another thing. Well,
Yeah.
we're always having to remind patients, because everybody's on them basically. So
Yeah. Or
yeah.
where you're at, are you seeing people like hit their goals and then get off of them?
No,
Not so
I'm
much.
I'm it's interesting. In my office a couple of weeks ago, and I actually made a video about it. I had like three ladies come in, and some of them were like a BMI of 18, or deaf, and so I was chatting to them about it, and they're like, "Oh, I do it for wellness," and it's that's a little bit controversial, because it does decrease inflammation, but I think the jury's still really out as to whether the actual drug itself is like helping with wellness or longevity or
Yeah.
any of the things. But I do certainly see in Miami, folks are staying on it, for good,
Yeah,
so.
that's what I see out here a lot. Like it's like with my clientele, they're all pretty like serious, and I mean like they're all in great shape, so they're not really doing, but all their friends are, and it's like they'll be like they get to the point, and this is them, and this is again, I think GLPs are like super life-saving tool for the right situation, but they'll be like they get to the point where they look good, and then they kind of went past there, and like now they're skinny, but they don't look better skinny, like they kind of just look like
Yeah.
the skinny fat. So yeah, I do think that. I don't know. I guess it's probably like psychological, right? It's probably just hard to you think you potentially could have a little bit of like going back to where you were?
Yeah, yeah, for sure. It's like a little bit of something is good, so a lot of something must be really good. It's like I think there's that, or yeah, like you said, people are just terrified. They want to, cut out the food noise.
Yeah.
People talk about.
It's so
It's
common
affecting.
with competitors now. There's a lot of like competitors that do. And one thing that I see, and it's kind of talked about, it's all new, right? Bodybuilders are always kind of like the first ones to test out drugs if they could have an impact on anything like that. And what it seems to be is like, there just seems to be like a little trouble like actually looking good if you take it close, like too close to the show. Like you don't fill up the carbs, your system doesn't take in enough and like shuttle the things to the muscles. So it's kind of like people use it like in the early part of the preps or like maybe like towards the end, but then they stop a few weeks out. It seems to be the way. But for bodybuilding purposes, I've never seen someone look better with it than without it on stage. And I think it's just because of how they store it within their muscles.
Yeah, yeah. I mean, it definitely makes sense, and definitely in a lot of those patients, like we talked about, they lose all the fat from the face, which ages you.
Yeah,
So
that's big. And then
yeah.
you're injecting other stuff to try to balance
Oh
that
yeah,
out.
yeah. All the
They're
colors and yeah,
they're probably one of the ones that do the more of the butt the butt job and stuff. Um,
yeah.
So I guess we could talk about this. There's always a little bit of controversy. I had a trans guest on once, and that was awesome. He was actually so I didn't. He was a competitive bodybuilder, and he had done the top surgery as pre-puberty, and he did it like this was before it was a thing. So he did it when it was considered like a mental disorder, and he actually had the belief that it is, and that's okay, that we need to, be able to recognize that. And he had a really cool take. He was really, really cool to talk to, but he looked amazing. And it was almost like how all the trans athlete controversy, that's kind of like crazy, right? Like you can't be, a male competing against females. Obviously, that's like a disadvantage born male, but like he was born female and competed as a male and he won his class, and that's one of the only things I can think of where it could potentially be beneficial to be transitioned from female to male because he is in classic physique and it is based off your weight and height. So with that structure, he can in the joint structure, he could essentially, have a lot more muscle mass and he just carries it so well. It
Yeah,
looks like perfect for
yeah,
that division. So that's kind of interesting to me because that's literally one of the only things I can think about that. But what
yeah.
I was curious with the new administration and everything over the last few years, are you noticing like more trans operations? I'm sorry if I don't know if I say the right shit. So, are you seeing more surgeries like that or less? Has there been a decrease?
Yeah, so it's interesting. It really depends where you are in the country. So, we had a time. like shortly after I got out of training, I was suddenly pretty busy with that stuff. Like about 10 years ago, as people, there's more social acceptance. People, the medical associations in America were finally kind of figuring out how to help people, and there traditionally was this idea that like it's a little bit like conversion therapy almost, that that like you said, being trans or having gender dysphoria, that was like a mental disorder, and we need to convince you that you actually are a woman or a man or whatever. And so what we understand is, if we're concerned about the well-being of that patient, which we should be, as medical folks and healthcare providers, is the better thing and the more successful thing is to change the body to how the patient identifies. And so kind of our whole thoughts, and it was hard, like the Western medical organization took a long time to come around to this because we're scientists and we're like, no, there's chromosomes, and it should be this. And so we understand from a well-being point perspective, like a person's identity should be number one. And then, we can fit the body. And now we understand we can do it very safely, whether it's with hormones or surgeries, to match the patient's identity. So, back in the day, if you, let's say you were gay, there was this conversion therapy kind of idea, like, no, you're not, you're straight, let's convince you otherwise. And kind of the same thing, with being trans, is now we understand as a medical community that you don't try and therapy out of somebody out of, how they identify, that this identity, we don't fully understand. We don't have tests for it, biological tests, but it's definitely very real. And if we want to help people, that's the way to do it, because it's way more successful than any sort of conversion therapy. So, I mean, it's been a part of my career. It's extremely satisfying. Unfortunately, there's a lot of myths out there. And a lot, a lot of misinformation, and it's kind of, just like philosophically, it's kind of the one group you can still kind of discriminate against and almost keep your job. It's not okay to be racist, thankfully, anymore. But a lot of people, will still pick on that community. It's a small community. For the most part, these patients, are just trying to live their lives. They're trying to do their thing. Regret rates in that group are incredibly low when it comes to the surgeries. We say it's been studied a bunch of times, and it's less than 1%. And if you compare that, to your typical Miami girl, let's say, who comes to my office requesting double D's, her chances of regret are much higher, for her breast implants or whatever. If we look at knee replacements, the regret rate there is 14%. So again, it's one of these things, just let people do their thing. But unfortunately, it's become very politicized. And it's a little bit sad for us because we're here in Florida, of course, which is a more conservative state. So a lot of people, especially internationally, they're afraid to travel in now, because of the current administration, which is understandable.
I guess that's
Um,
probably by me. I'm assuming then they're probably doing a lot out here.
Yeah, 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 yeah. California, it's definitely like considered a safer state, So yeah, for sure, there's still a lot of procedures going on, but I think in spite of everything that's going on at the political level, the procedures are here to stay.
Yeah.
That's what we're seeing in the medical field. So
Yeah, the guy I had on, he was really really cool to talk to. It was so funny because I had like you can see who unsubscribes. I got like quite a bit of unsubscribes when like literally he had a pretty conservative point of view. He thought like a Republican about it. He just said, "Hey, I need this because I'm too fucked up mentally to be happy in my life in my own skin. So I need this for me." And so, but he did it like really young, and that was a big thing. He had to. That was back when they had to go to the institute in New York, I think, and he had to spend like weeks there. And so it was a big thing. And now it's way more common. He didn't have the bottom done yet. He was kind of like waiting, like to see if there was a point where it's just they got it nailed. Or where are we at with that right now? Is that something that you do?
I mean, so I do some of it, but I'll be the first to admit it is, especially for the guys, so people transitioning from female to male, that anatomy, it's very complicated to reproduce. And so, I feel like for the girls, so for the guys to male to female, it's a better procedure. It works well. It's like one of my mentors always says, it's easier to dig a hole than bitch a pool. So it's unfortunately like a lot of guys, a lot of trans guys are in the same boat right now. A lot of them won't seek out those procedures because there can be a lot of complications, with them. And so a lot of folks go without, still.
So when
Plus, the whole, issue of access because they can get really expensive as well,
yeah.
so.
Yeah, and it would just suck. Can you imagine like you do this big huge thing and it doesn't work that good, and then like I don't know, a couple like 6 months later they have this procedure down. You're like just fucking waited a little bit longer.
Yeah,
Are you like with the women? Are they able to like have sensation when they build the tunnel? They dig the hole?
absolutely. Yes. It's quite a like an elegant procedure if you think about it, because when we're embryos, we kind of all start from the same stuff, and we call it like homologous, development. So what we try to do, it's almost like reverse embryology. So you're trying to replace like with like, and definitely for trans feminine patients, it does work quite well. So typically we're making the clitoris from the glands of the penis. We're keeping all those nerves intact, that we talked about. And so they'll retain their sensation there. And then when we do the vaginal canal, interestingly, about 2 inches in on the anterior wall, Miss Prostate will be living there because none of us take out the prostate. There's important nerves there, that sort of thing. So some patients almost describe that like they have a G spot now as well.
Yeah.
So from a perspective, it does tend to work a lot better for the girls. Yeah.
Yeah, that's wild. It's just crazy how far, it's come from whenever I first was in Hollywood back in 2010 to now. Like the surgeries are just, just way more advanced. It used to probably be, it probably used to be like a really hard decision when it was so early and like not that good.
Yeah.
I was curious. Something that I saw in Hollywood, and I don't know if this is just Hollywood, is I saw it made me think of it. It was actually a trans person who they transitioned from female to male, and they also said they went from Puerto Rican to Irish. Is this something
Oh,
you've ever seen? Is this something that plastic surgeons do somehow? Is this
I have to say, I don't think I've ever seen that.
yeah, like
It's
the trans ethnicity
yeah,
thing?
ethnicity thing. No, yeah, you got me there. I haven't seen a single patient like
I think that's West Hollywood, and I think you can only go from darker to lighter. I don't know if it's PC to go from lighter to lighter to darker, but
uh,
it's funny. I mean, bodybuilders hate this shit, but I'm just curious about. I think it's so interesting. It's the science, it's crazy what we can do now. Before I let you go, I was curious what's maybe the hardest surgery you perform, or maybe like a one-off surgery that you did that was particularly challenging.
it would have to be so right now mainly what I do is aesthetic procedures typically. So I mean some of it falls within the realms of reconstructive, because you could argue that if you have somebody who has clitoromegaly or a very enlarged clitoris, you're kind of reconstructing them back to how it should be. But I have to say in my practice now I'm a little bit spoiled because I used to for gosh, like 5 years I worked at the university, and those were tough times because you're dealing with situations where you'll be called in at night to another surgeon has like done what we call a big whack, so they've taken some huge cancer off somebody, and now there's a big hole. And they're like, okay, off you go. And it's already like 9 o'clock at night. And you're like, oh my goodness, how are we going to? So we used to do what we call microsurgery, which is basically where you take the tissue off the body completely, like so it's on the table, it's kind of dead, except for it's not really dead, you don't let it die. And then underneath the microscope you reconnect the vessels and in some cases the nerves, and get the blood flowing through it again. So in some of those big reconstructive cases, or somebody's very bad trauma in the lower leg, to try and save that leg, you'll have to do what's called a free flap. So you're taking like the latissimus or the abs, sometimes like different muscles, different chunks of skin and fat from around the body, and putting it down. So it's the microsurgery that used to always scare me because it's tough. It's really difficult to get that blood flowing through again. But I have to say that the worst case I can ever think of is the table saw injuries. So kids cut all their fingers off and
Oh
come
my
in.
God.
They all come in at 2 a.m. and it's always like 5-year-olds and
On
like
what? On a table saw?
a table saw. I
They're like
don't know how.
in their dad's garage or something like, and you can reattach
Yeah,
those or what, and they keep
like
function.
you
That's so
try,
cool.
you gotta
Yeah,
try. Yeah. So you reattach them, but like each of those little
yeah.
tiny little vessels, those are the ones that, give me PTSD, because they're extremely difficult cases. So yeah,
Oh
yeah,
man, especially a little one. So
yeah,
about the men. So like where I'm from, what I see right now, I have what was she? Oculoplastic surgeon, I guess. She's an ophthalmologist that does the plastic surgery
yeah,
for
yeah,
eyes a bunch, and there are just tons
yeah,
of guys doing eyelids. That seems to be super
yeah.
popular out here. Was is it
Yeah.
what's kind of what's the main procedures that men are doing, like plastic surgery wise, that you see?
Yeah, so like definitely like we're seeing with the GLPs, we're seeing a lot of facelifts. A lot more guys are getting the facelifts for sure. In my practice, it's more body contour, and blepharoplasties are really popular because it seems to be you turn 40, and like it would depend on your ethnicity, but if you're Irish like me, you turn 40 and next thing you have all this loose skin. It's almost like your skin around your eyes grows. So, blepharoplasty is a really nice solution for that. It heals super well. So they're just getting rid of the extra skin there and it makes them not look so tired. But there are nuances to it. You can, same thing with the brow lifts, you can feminize a guy, if you do too much of that. And we've all seen it, so some guys in Hollywood. The other thing that's very popular is building up the jaw as
Yeah.
well. I see that in patients a lot. Typically it'll be done with filler, but there are implants you can put in there as well. Those things are very popular. Hair transplants, obviously, they work
Oh yeah.
amazing.
Yeah,
They
those are
work
that's probably the most common with bodybuilders now. The jaw stuff is crazy. Have you seen these kids online that are breaking their jaws with these little things? And like
yeah.
that's so wild.
I don't see how that could work. I mean, they're like, I mean, I just know it doesn't work. Like, I guess they take a hammer to their jaw, and the
Yeah,
idea.
I mean that I guess is that the same thing as like the limb lengthening thing where they break their shins and it like bone grows, but
That works. That
yeah,
you can get 6 inches from that.
yeah, it's just you're just gonna have like most of those have pretty shitty quality of life after. That seems like nuts. I've been like there's a real popular guy. I don't know if you've seen him online. He was 6 foot now. I think he gained. I think he went from 6 to 6'6" actually. I think he was already tall, and
Yeah.
like he's like 2 years in, and now he can walk. And like people always
Yeah.
make these comments are like this is the stupidest thing ever. He goes, I know I regret it, but I'm honest, and here it is. This is just the recovery. So I think that kind of stuff is so valuable for people to just to be honest with their decisions and recovery process with stuff like that, just to help other people because there are tons of kids that they see the one or two like kid the guy who maybe got a good result and like I'll save up my money when I graduate I'll go to Thailand. Like I see this on like Reddit and shit. I'm like
Yeah.
this is crazy.
Yeah. Yeah. No, I mean, that surgery is fascinating to me. Like, you can make the bone grow, like it's called osteodistraction. You kind of pull the bones apart and it fills in little by little. But yeah, the hammer to the jaw, nah,
Yeah.
I don't see that
I
would
don't know
work.
if it's just trolling or what. That's funny. And then
Yeah.
last question I'll give you, and I'll let you go. Appreciate your time.
Yeah.
What is upcoming now? You mentioned bones a little bit. Like, was there anything that's kind of just now getting out there and cutting edge, or we're really close to that you think will have a big impact on like the plastic surgery world?
Yeah, so I think bones are the future. I do think we're going to be doing more of that. We're going to be doing more modification of the ribs, because in my practice, I usually only do the bottom ones to 12, 11, 10. But I see other surgeons are venturing a little bit higher. It definitely gets more dangerous the higher you get, So like I said, I'm a chicken. I stay low and safe. But that we're going to see more of. One of my mentors, for example, is doing shoulder remodeling. So he's coming in here, for example, on women who feel like their shoulders are too broad, and a lot of the times it's transgender women, so transition from male to female. He makes a little incision here, and he can reduce the shoulders down 3 centimeters each side. And so again, it's like really dramatic, and he plates it and gets them mobilized real quick.
Wow.
So he's got that down to a fine art. He's done a few the other direction, but it doesn't tend to work quite so well, because it's much harder to pull out the shoulders, for the guys. And so yeah, a couple of other things. I saw one of my other mentors, unfortunately it was in Spanish, so I didn't follow it all, but he was talking about pushing out the coccyx, the
Yeah.
tailbone. to try and get a little bit more booty
Yeah,
pop,
that sway kind of, yeah. Which sounds
Yeah,
terrible from my perspective when I think about biomechanics and stuff. I'm like, oh,
I'm sure you're like, oh my goodness. So yeah, yeah.
yeah,
So, but yeah, I think the bones are the future. And one thing I always see in my practice with because I see a lot of patients who are massive weight loss folks, and you can see, I mean, you know all about this better than I do, but the especially the thorax can get very distorted.
yeah.
So like maybe and you do beautiful skin surgeries, but it's very hard to kind of restore that anatomy. So again, in the future, I think maybe flare ribs, all that sort of thing, we're going to be seeing procedures for those.
Yeah, I've seen people do procedures for flat ribs where I'm like, okay, if I could help you with that a little bit first. You can try it first. You can breathe the right way. That might help a little bit. Are we doing anything with stem cells in like surgery? Is that stuff that like,
Yeah, for sure. In the plastic surgery world, again, there's a lot of stem cells and fat. So, what we've been doing, I mean, for a long time now, is particularly in the reconstructive world, if we can't get a wound to heal, we'll liposuction and inject some of that fat in there, and we do see those growth hormones working. It's used a lot more for facial rejuvenation now as well, fat grafting. So that's typically where we get our fat cells usually. But there are new technologies coming down the line. There's like buzzwords, exosomes, that sort of thing. Is definitely coming down the line. So there are new kind of technologies coming along there.
yeah, I feel like a lot of the medical community, like surgeons especially, it's like you get really good at stuff and then stuff can completely change. And it's like you either get really good at the new thing or you just stay really good at what you were doing before. And so like I had some hernia repairs and I was able to do the Da Vinci robot and that was like super, super awesome, super easy recovery. Do you do hernias at all? Is that something you deal with?
I used to in my old life. Actually, what am I saying? I did a bunch of hernias last week on the same patient because I did a tummy tuck, and when I went in there, I mean, I knew she had an umbilical hernia, so yeah, yeah. Sometimes I still do them, but in the what do you call it? In the tummy tuck world, you're wide open. I have a huge incision, so it's much easier.
Yeah, I had a
Obviously,
yeah, no, I had a lady who just had her mommy makeover. She had her last kid, and she had the diastasis because she had her first two kids like they're Irish twins practically, and so and then she had a third one later that she knew, so she just kind of waited, and she had an umbilical hernia, so she just had such. I mean, she was such a beautiful girl, had the most unaesthetic kind of like just belly pooch like posture, and then after she had her abs like sewed back in, she comes back and it's like different human being. Like she didn't have like really fat to take out. She didn't take out any fat, but like just like being able to be in a stacked position to have her abdominals actually start to activate. She started growing her butt so much better. Like everything looks so much better because now like her core can like center herself. And it's such a huge difference.
yeah, yeah. It's a very gratifying thing. So yeah, we do that often, and it's even a lot of my patients may not have even had kids, but if they lose a lot of weight, it's like they'll have had a lot of that visceral fat, and it kind of does like the same thing. So that when everything deflates, they'll have that diastasis. Not unusual. We'll see
Is
that.
my baby's screaming. Is the recommendation now to get your hernia fixed like earlier, or have they changed it? Okay, yeah.
It seems to be, yeah, yeah. So it's if you know it's there, you should fix it, because depending on the type of hernia, the inguinal hernias down in the groins are super common.
That's what I had.
Um yeah, yeah. So
Bilateral.
yeah, because they can actually get incarcerated or trapped,
Yeah, that's what
so
almost happened. So that's what I was told to like wait until it became a problem. And I tell people don't wait. I just make sure I wasn't giving them bad advice. I was like, it's only gonna get like worse potentially. It's not gonna get better, so might as well nip it in the
yeah,
bud.
no, your intuition is 100% right. And I know that is the modern way of thinking. I just recertified as a general surgeon last year, and that was one of the the questions, so that has changed,
Okay,
the
good.
recommendation and treat it. So yeah, you're
Nice.
absolutely right.
Well, thank you so
Yeah.
much, Saif. I appreciate your time. You are out there in Miami, so if any guys need some fake balls or anything at all, definitely look it up. Is there anything you want to put out or anything?
No, like, I mean, just again, thank you so much for having me. And it's great to get the awareness out about the genital procedures, because like I said, it's so gratifying. But a lot of the patients I see who come for these things have been suffering in silence for years,
Yeah.
so It's so great to be chatting with you today, and thank you for having me.
Yeah, I appreciate it. I'll link your Instagram down below so you guys check that out, see some cool stuff. And also, you have pretty good sense of humor. You're pretty funny on some of your stuff, so it's worth a follow for sure.
Part of my job. Yeah.
Awesome. Thank you so much. Really good to meet you, Sidhbh.
All right. Great meeting you. Take
All right.
care.
Take it
Bye.
easy.